Like many of you, my family was deeply affected by the COVID-19 pandemic. It was a time of grief, confusion, and fear, but also a time to reflect on how we respond as individuals and as a society to crises like this. This presentation is more than just an exploration of obedience and compliance. It is a tribute to those we have lost and a call to understand how our actions, whether guided by trust, fear, authority, or social pressure, can make a difference in times of global emergencies. Let's begin with the context of the pandemic. In late 2019, the Huanan seafood market in Wuhan, China became the suspected origin of the SARS-CoV-2 virus. By early 2020, the World Health Organization had deployed its incident management support team, and Wuhan entered a strict lockdown. This measure quickly spread worldwide as nations raced to contain the virus. But compliance with these measures varied greatly, from total adherence in some regions to outright rebellion in others. The pandemic revealed profound difference in trust, governance, and cultural values. Consider this timeline. In January 2020, China's lockdown in Wuhan was the first of its kind, inspiring similar measures globally. By March, Italy became the first European country to enforce a nationwide lockdown. Soon, countries like New Zealand, the United States, and Brazil implemented their own strategies, each with differing results. These actions raise an important question. What motivates people to comply? To understand compliance, we must first define two key terms. Obedience to authority is the act of following direct orders from a figure of authority. A classic example is the military, where orders are expected to be followed without question. Compliance, on the other hand, involves adhering to a request without the presence of authoritative power. Think of it as saying yes to a friend's suggestions or advice. Let's illustrate these concepts in the context of the pandemic. In New Zealand, people comply with lockdowns because they trusted the government, even without strict enforcement. In the United States, compliance was mixed. Some states followed national guidelines while others rejected them, leading to varied outcomes. In Brazil, confusion and a lack of cohesive leadership eroded public trust, resulting in widespread non-compliance. Why do people follow rules during a crisis? Social psychology offers valuable insight. During a crisis, individuals often develop a shared fate, fostering cooperation. Trust in government and health officials becomes critical. Social pressure or the desire to conform to group norms play a significant role. To understand why people comply or didn't comply during the COVID-19 pandemic, we can look to establish theories of obedience and social influence. First, let's explore Milgram's theory of obedience. In 1963, Stanley Milgram proposed that having a structured system of authority is crucial for collective living. In times of crisis, obedience to authority ensures order and helps coordinate societal responses. During the COVID-19 pandemic, this principle was evident. For instance, a study by Gourrier and colleagues in 2020 found that 58% of Italians trusted government and public officials to provide accurate information about the crisis. Even skeptics of health measures were more likely to comply when they believe in the credibility of these authorities. Now let's shift to the theory of social influence and conformity. Social influence refers to the way individuals are impacted by the behaviors or norms of others. During the pandemic, normative influence played a significant role. This type of influence occurs when people conform to a group norms to feel accepted or avoid rejection. In Italy, for example, compliance with lockdown measures was shaped by social pressure. Barrari and colleagues highlighted how Italians expressed and emphasized a collective duty to follow the rules. They knew that failing to adhere to the quarantine could have dire consequences for everyone. Lesko described conformity as a behavior that can create internal conflict, balancing personal belief with societal expectations. However, during the pandemic, this internal conflict often gave way to collective action driven by a shared sense of responsibility. MacLeod, in 2023, also states that Solomon Asch experimented with investigating the extent to which social pressure from a majority group could affect a person to conform. As in the Asch experiment, the pressure to conform was visible in the use of masks in public settings. According to Besch, he found in his study that German people were more likely to adhere to the use of masks when they saw others in the community using it. This study mirrors Asch's experiment, where group behavior influenced individual decisions. Understanding these frameworks of obedience and social influence not only explain behavior during COVID-19, but also highlights the importance of trust and community in managing global crises. History shows us that obedience is not a new phenomenon during global crises. During the bubonic plague, medieval Europeans turned to religious leaders for guidance and stability. In World War II, authoritarian regimes leveraged strict obedience to maintain control. And during the Cold War, civil defense programs promoted survival strategies that required public cooperation. This example reminds us that in moments of uncertainty, people look for authority figures they can trust. The COVID-19 pandemic was no different, with varying level of trust shaping compliance worldwide. Compliance with health regulation was a crucial factor in controlling the spread of COVID-19, and it varied greatly across different regions and individuals. To understand the factors that influence compliance, researchers have identified key psychological and social drivers. A study conducted in 16 countries showed that individuals who felt trapped or restricted by the lockdown measures were less likely to comply. The sense of being caged led to resistance against following rules. On the other hand, those who complied often did so because they felt a deep sense of responsibility and had a genuine fear of getting infected, as shown in the research that Hadju and his colleague did in 2022. Trust in government also played a significant role in fostering compliance. Han and his colleague found that there was a strong positive relationship between trust in government and the willingness to engage in pro-social behaviors. Moreover, individuals' attitudes and beliefs about health regulation were shaped by the norms of the group. Capstone and Silvanathan and Gourrier and colleagues in 2020 explained that when people felt their behavior was consistent with the guidelines, in this way, conformity to social norms helped reinforce compliance, making like a group-driven effort. Overall, compliance during COVID-19 was not just about personal fear or government mandates, it was also a reflection of social dynamics. Compliance wasn't a one-size-fits-all concept. It varied significantly across the country's communities and individuals. Let's dive deeper in global compliance rates. Studies reveal that compliance depended on several factors. In Finland, trust in the government was a key driver of high compliance. In India, fear of infection motivated adherence to lockdowns. And in Netherlands, misinformation and distrust in science led to low compliance rates. These findings highlight how trust, fear, and cultural norms intersect to influence behavior. Case studies provide a closer look at how different nations responded. In New Zealand has seen that ardent, transparent communication foster a sense of unity and resilience. Vietnam adopted a community-centered approach ensuring continuous support for its citizens. On the other hand, examples of non-compliance reveal the challenges. In South Africa, strict regulations were undermined by financial hardships. In the United States, conspiracy theories and political polarization fueled resistance. Leadership plays a pivotal role in shaping compliance. In South Korea, Dr. Yoon Kyung-jong built trust by presenting evidence-based updates. In Bangladesh, religious leaders partner with health officials to spread accurate information. Conversely, poor leadership can erode trust. In Brazil, conflicting messages from President Jair Bolsonaro created confusion, weakening compliance efforts. As we dive deeper into the research findings surrounding compliance during the COVID-19 pandemic, we uncover the critical role of social trust, political identity, and cultural values in shaping individual and collective behavior. In countries like New Zealand, the trust in the government leadership played a pivotal role in ensuring public compliance with COVID-19 measures. According to Baker and colleagues in 2020, Jacinda Ardern government gained significant trust, which led to strong adherence to lockdowns and mask mandates. The clarity and transparency of communication foster a collective responsibility to protect public health. However, trust in the government is not universal. Political identity has been shown to heavily influence compliance behavior, especially in countries like the United States. Gourrier and his colleagues in 2020 found that compliance with COVID-19 measures such as mask wearing and vaccine uptake vary widely based on political affiliations. In particular, Republican-leaning areas reported lower compliance compared to Democrat-leaning regions. This polarization reflects the power of political identity shaping public health behavior. Cultural values also play a significant role. In countries like Japan and South Korea, mask wearing was a common practice even before the pandemic. As Han and his colleague in 2021 point out, this pre-existing cultural norm helped this society quickly accept and follow COVID-19 guidelines. For them, wearing a mask wasn't just about personal protection. It was a reflection of respect for others and a shared sense of responsibility. These findings underline the complexity of social dynamics in a global crisis. The factors that influence compliance are as diverse as the populations they affect. So, how can we improve compliance in future crises? Build trust through transparent communication between people, health officials, and government. Being transparent and inclusive in policy making. Counter misinformation with centralized fact-checking platforms, as seen in South Korea. Support vulnerable populations with financial and emotional resources. Engage community leaders to provide rewards. To address non-compliance, we can look to successfully strategies that promote cooperation and build trust in public health guidelines. One effective strategy is tailored public health messaging. In India, for example, religious leaders collaborated closely with public health officials to address vaccine hesitancy in rural areas. Banerjee and colleagues 2022 found that these trusted community figures played a key role in shifting perceptions and encouraging vaccination, demonstrating how culturally sensitive communication can make a difference. Combating information is another critical component. In South Korea, a centralized fact-checking platform was established to debunk COVID-19 myths. This initiative was crucial in improving adherence to guidelines, as it provided accurate information and countered the false narratives circulating online. Transparency in policy making is equally essential. In New Zealand, Prime Minister Jacinda Ardern emphasized the importance of transparent decision making by openly sharing her approach to policies and providing clear justifications for lockdowns and other measures. She built public trust. Her transparent leadership fostered confidence in the government actions and ensured a stronger public cooperation. Lastly, strengthening community involvement can significantly boost compliance. In Brazil, health professionals work directly with local communities to improve vaccination uptake. This hands-on approach was vital in reaching vulnerable populations and addressing barriers to compliance, as highlighted by Barberie and Gomez in 2020. The COVID-19 pandemic taught us invaluable lessons. Public health crises are also social crises, shaped by trust, identity, and community behavior. Future research must focus on combating misinformation, understanding cultural influence, and addressing socioeconomic barriers. As we reflect on the impact of COVID-19, it's clear that this global crisis has had a profound effect on how we prepare for and respond to future challenges. While this pandemic exposed weaknesses in global preparedness, it also highlights crucial opportunities for growth, collaboration, and innovation. COVID-19 underscored the need for a more collaborative approach, where countries, communities, and organizations work together to tackle global issues. It shows us how technology, innovation, and the rapid sharing of information can lead to breakthroughs, such as the development of vaccines at an unprecedented speed. At the heart of this crisis, however, was the role of social dynamics, how trust, identity, and community behavior influence compliance with public health measures. Understanding this dynamic is key to designing an inclusive public health system that not only responds effectively to crises, but also fosters long-term cooperation among more diverse groups. Trust in authorities, cultural identities, and community norms all play significant roles in shaping how people respond to the pandemic. By analyzing these factors, we can create systems that are more responsive to people's needs and more effective in gaining public support during future health crises. As we come to the end of this presentation, I want to take a moment to reflect. The COVID-19 pandemic wasn't just a global health crisis. It was a deeply personal one for so many of us. This experience had taught me that trust, unity, and compassion are not just ideals. They are necessities. The choices we make, the leaders we follow, and the strength of our community shape how we overcome challenges and how we remember those we have lost. So as we move forward, let us carry the lesson of this time with us. Let us honor those we lost by building a future rooted in trust, empathy, and collaboration, ready to face whatever comes next. Thank you.